Hello, my name is Maldonado of Hispanocare, a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial Hospital. You are watching a live, interactive, call-in television program brought to you on CAN TV 21. During the next 25 minutes, we are going to be discussing dementia and Alzheimer's disease. We invite you to call with your questions at 312-738-1060. Our phone lines are now open. Now, before we begin, I would like to begin with some facts regarding dementia and Alzheimer's. 5.4 million Americans are living with Alzheimer's disease. 1 in 8 older Americans has Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death in the United States and the only cause of death among the top 10 in the United States that cannot be prevented, cured, or even slowed. More than 15 million Americans provide unpaid care valued at $210 billion for persons with Alzheimer's and other dementias. Payments for care are estimated to be $200 billion in the United States in 2012. Now joining me today is Kathy O'Grady, Coordinator of Memory Loss Assessment with Advocate Healthcare. Allow me to welcome you and thank you for being on the show.
Thanks for having me.
Now, Kathy, can you tell us a little bit about yourself, your background?
Well, I have been with Advocates Memory Assessment Clinic about 2 years. Prior to the assessment clinic, I worked at the Lutheran General Hospital, which is located in Park Ridge, on the geriatric psychiatric unit. So prior to my position currently, I was a social worker that did discharge planning, social work services for people who had come into the unit, which is a locked unit, for people with not only issues related to memory loss, but also with mental health issues. So I've been with Advocate now going on close to 9 years.
Right, okay. Now, before we move on, Kathy, can you explain to our viewers the difference between dementia and Alzheimer's disease? Because there seems to be some confusion about that.
Right. With regards to dementia, dementia is a group of symptoms. It would be similar as to saying someone has a cold. When we think of having a cold, we think of congestion or coughing or sneezing, flu-like symptoms. That would be similar with dementia, that people are concerned about their memory. They may be having personality changes, and they are unable to retrace their steps or even tell you what their day was like. So when we talk about dementia, that's the umbrella that people that fall under. But with the different types of dementia, that's when we start to talk about Alzheimer's dementia, Lewy body dementia, vascular, Pick's disease. There's several different types of dementias.
Oh, wow. So, yeah, because I was actually doing some research on this, and yeah, when they said Alzheimer's is a type of dementia, I was like, okay. But you just explained it to me. There's actually all kinds of different types of dementias.
Unfortunately, there are. With regards to Alzheimer's, that's the type of memory loss that most people are affected by. And that's a consistent loss of memory over time. So changes that are consistently happening over a certain length of time. With vascular dementia, that may be related more to people who are suffering with strokes. Mm-hmm. So they may have a sizable stroke, or even what we call TIAs, mini strokes, right, that significantly damage a person's brain, that they may improve upon with physical therapy or speech or occupational therapy, but unfortunately they may then be at risk for a stroke at a later time. So there is vascular, there's Alzheimer's, Lewy body would be association with Parkinson's-like symptoms. So when we see people who are having maybe visual hallucinations, or even tremors in the hands, that can be associated with that specific type of dementia. And unfortunately, there would be even another that would strike younger people, which would be frontal temporal dementia. Wow. Would be more prolific with people in their 40s or 50s with significant personality change, And when we talk about that, it would be maybe even specifically with a loss of empathy. So they would have a very much struggling with understanding what's going around them, how they should be feeling. And with those types of dementias, we want to make sure that we are treating specifically to the types and that people have specific types of education for their diagnosis.
Gotcha. Now, what causes dementia? What brings this about?
We think it's damage to the brain cells. And we often hear about plaques and tangles within the brain. So those are unfortunately damages that we can't take away, even with medication. So with regards to how does it come about, there is not one specific answer that we can give for the diagnosis. We know it's related to damage of the brain cells, and the types of damage can occur to specific areas of the brain. So that's why some people have a pronounced change in personality. Some may have difficulty with speech. Some may just be having that progressive loss of memory over a number of years. So with regards to how is this happening to people, there's no set answer. It could be related to a hereditary problem that people will often ask, since my mom or my father had this problem, do you think this could be related to me? There are those links. Unfortunately, with vascular dementia, that could be related to smoking, excessive smoking, or excessive use of alcohol. With the Lewy body, again, that could be related to Parkinson's disease, which is, again, difficult to treat, but we want to try to manage the symptoms. So when we're giving specific reasons as to why this happened, we don't always know. And that's probably one of the most difficult lack of information, if you will, that we need to tell families, that we can't always pinpoint exactly when or why this started to happen to the person, but our issue is now to deal with the problems and make the person as comfortable and as engaged and maintain as much independence as they can.
Gotcha. So really, it's one of those things where I know it's a misconception to say that dementia is specifically just of old age. It's
Right.
a number of things, and I mean, most people out there think, it's just, he's getting older. It just happens.
Right.
So it's a number of different factors that come to play in this. Now, what are the treatments for dementia? What can be done to stem the tide? What's out there to
Sure.
treat this?
With regards to medications that are available, there is a limit on there. There's the most often medication prescribed is Aricept. And Aricept comes in about a 5 milligram or a 10 milligram. We usually start patients off at 5 milligrams. And within 30 days or soon thereafter, we would increase it to 10. There's a second medication that's called Dementia. That is a secondary medication that we hope will benefit the patient, as in that it's protecting their brain a little more. And the third would be a type that is related to Aricept, but it's a patch form.
Okay.
So people can take medication by pill form, or they can use a patch. So when we're talking about the types of medication that we can prescribe, those would be the main types that we have. But the main goal that we would have for families and for the patients themselves to improve their situation is, again, keep them as involved as possible with doing their activities of daily living. So doing as much as they can with what they can, as often as they can. So whether that be doing the dishes, walking their dog, joining in their social groups in the community, we would encourage people to do that. So when families come into us, we often talk about how do we keep the person most active. And those would be the suggestions that we have, is to include your family in discussions that you normally have, encourage people to attend adult day programs, which there are several in the communities that we can give families referrals to, and also by joining support groups that we have so that families are aware of what options and what plan of care are available for their loved ones.
Perfect. Now, I want to take this opportunity actually to put up your contact information. In case anyone has any questions out there, here's Kathy O'Grady's contact information. As you can see, 847-384-3306. And I also want to remind all our viewers that this is an interactive live TV show. So I encourage you to call with your questions at 312-738-1060. Now, obviously, everybody, forgets things, here and now. And so when that happens, I mean, should that be a cause of alarm? Now, for example, and this is true, the other day I actually drove up to the ATM, and I use the ATM constantly, every day, almost every day, for whatever reason. My PIN number, I forgot my PIN number, totally forgot it, went blank. I had to go into the branch and get a new PIN number. I felt like, how's this possible?
Right.
And I was like, what's going on? But things like that do happen. But, so basically, I guess my question is, at what point should it cause concern?
I think the cause for concern happens when people cannot retrace their steps. So many times people will come into our program, and when we evaluate them, we ask specifically what has been going on. And a person may say, I go into a room and I cannot remember what I came in for. And that would be in line with what you're talking about when you go to the bank and can't recall your PIN number. But usually, within minutes, people can say, I remember I came in here for my checkbook, or I came in to get a magazine, or if I think of it a little more thoroughly, I can recall my PIN number.
Yeah, I actually remembered it 2 days after,
Right.
but I had already reset
Right.
it, so it was like...
So that's when we talk to families about, are you able, given a few minutes, to retrace your steps? And sometimes people can say, no, I walk back out, and it may take me several hours to go back in the room and get what I'm looking for. That would be a cause for concern. If that is consistently happening, if that's happening over a length of time, the sooner the better. We would encourage people to come for an evaluation, especially if they have this issue running within their families. So unfortunately, many times people will tell us that their loved ones, especially their parents, died at an early age, so they're not sure if this was a disease within their family. So what I encourage families to do, again, come in sooner the better. And what I like to tell families is, now that we see you at age 50, 65, whatever age you are, that you're coming in for your initial evaluation, then now we'll be able to track you. So if this becomes a problem that's getting worse, we can at least say that 2 years ago when we saw you, you were at this level. Or when we talk a little bit more about the point range for the mini mental status exam, we can say 2 years ago you scored this on the point range, but now at this time it's this number. So we would be able to track people's decline, if that was the case, at a better rate. So again, we encourage people not to be afraid. Though it's a difficult subject to talk about, people often equate Alzheimer's or dementias with getting a diagnosis of cancer.
Oh, wow. Yeah.
People are very worried to hear, and there's so many different types of cancers, that people didn't know that there were other types of dementia than Alzheimer's. So again, it's an area of education that we have to take care of. But we want to make sure that people feel that this is not something that they can't deal with or live with, that there are ways to improve the situation, such as getting yourself a calendar or a daily reminder. And if you need to write down information for yourself to prompt yourself to make the calls or take your medication. And those are other treatments that people will often say, I can't remember to take my medication. How can I work with that? There is even machinery out there that will dispense the medication at a certain time of the day or night. So there are ways of dealing with the problem, but we want to make sure that people have the diagnosis, the correct diagnosis, that they're being treated correctly, that they know that there are options of care out there, and that we follow them throughout the entire situation of their life, that we don't just end now with a diagnosis and hope you do well with that, that they're welcome to call for services at any time, whether it's a year from now or 10 years from now.
You walk with them through it, which
Yes.
is great. That's awesome. That's great. Now, when someone makes an appointment at the Memory Assessment Center, what kind of testing is done?
Sure. The initial appointment will likely last for about an hour and a half. In that initial appointment, the patient is going to see myself first. Ideally, we would like it if a family member or a loved one or a partner can also attend the appointment with the person as well. Just again for that verification of information. Because sometimes the person who comes in and we start talking about the issue, they may say, it's really not that bad. I'm really not having that much problem. But the son or the daughter or the husband or partner may say, actually, this is what I've been seeing the last year, and that's why I'm maybe a little more concerned than he or she is. So that first assessment is going to include a meeting with the social worker, which is myself, and we're going through everything, where they were born, type of education they had, what kind of work they had, what's their medical history including. So that will include time with myself, and then the person would see the doctor right then and there. And with our different sites, there would be a few different doctors a person would be able to see. Generally, they're either an internal medicine practitioner or a geriatric specific practitioner. And the geriatric or the practitioner will do what's called the mini mental status exam, which is a test that gives you a 0 to 30 point range. And when we talk about normal memory, we look at it from a number from 26 to 30. If we go to 24 to 26, that may be considered mild cognitive impairment. Yes, there is some impairment, but the person is doing fairly well with activities of daily living. And that may include even driving, doing their checkbook, again, all the things they've always done. But now they may need to pay a little more attention. If we get into the lower 20s, then we could show that this is a moderate loss of memory or even a significant. So we have had patients who have come into the clinic and they've had a single-digit rating. But again, this could be new to the family. The family may need, again, just now, here is the point range you've given us. Where do we go from here? So it's usually the test will include the mini mental status exam. If the person has a higher education, they may do the MOCA exam, which will include more difficult questions, even pictures that people have to identify. With those two tests, generally, if the person is 60 or older, we would ask also about depression issues, which often mask memory loss. So we can do the geriatric depression scale, which gives us again a scale of 0 to 15. 5 and above would be cause for concern that the person may be experiencing depression or anxiety. We would want to treat those symptoms first before we give a diagnosis of memory loss. So again, people are going through many different changes of life. We want to make sure that this isn't related to a medical issue.
Correct.
Or a change in their living environment, a loss of a loved one, loss of a home or a job. We want to rule all those problems out first, and then really tackle if this is the issue of memory loss related to Alzheimer's.
It's really in depth, and that's for sure.
It can last, the initial appointment, anywhere from an hour to an hour and a half.
Oh, okay. Well, that's not too bad. Great. Now, personal question here. I'm just speaking from experience. My mother's over 7 years old now. She says she's starting to forget things, and it does concern me. It's nothing serious yet. Now, this is something obviously that can't be avoided. Now, we actually spent some time talking about some different methods of what can be done to slow down the process, but in her case, and I'm sure in a lot of people's cases, I mean, she spends a lot of time at home. I know the mind needs to be kept working.
Right.
I mean, what do you suggest for someone like that to make sure that they're, keep it stimulated? Because I'm pretty sure if you keep your mind stimulated, you're going to stem that tide.
Right. And that's, I think, the issue, whatever age you are, that it's always a matter of keeping a person stimulated.
Yeah.
We come in and see patients often who have maybe retired. They've raised their children or their grandchildren, and now they're at a loss of how do I fill up my day?
Mm-hmm.
So we do talk to people about what do they enjoy, how would they spend their quality time given the opportunity. Maybe they did not know that there were community programs in their area that they could join, whether it's going to an older adult day program, Monday through Friday, or going for 2 hours or even 8 hours a day. Maybe they can go to the Illinois Department on Aging, has their own programs that they offer through the park districts. And that could be people going on a field trip. We have one group that I know on the south side at the Renaissance Center. They go bowling every Friday, and that's done as a group. So again, the issue seems to be when people are at home all day by themselves, they begin to feel isolated.
Yeah.
They're lonely. The anxiety level seems to increase as the day goes by, and people get frightened and worry about how is this going to be for the rest of my life.
Right.
So we really talk to people about what is one thing, at least every day, that you can do for yourself. And again, whether that's going out in their backyard and looking at their plants. We have one gentleman, he likes to spend a good hour in his garage just tinkering, and that's what he's always done. So we would encourage him to continue to do that. But again, maybe with a little more supervision, with the wife checking on him a little more frequently. Or again, people going to the programs that are offered, going and letting their family know that these are my concerns and I may need more help with this, and encouraging the family to work together along with their practitioners to make sure they're being treated correctly.
Perfect. Well, you know what? Time went by so quick. It definitely, we're out of time. Kathy, I want to thank you so much for being on the show today and sharing this important information with our viewers. Again, I'm going to put this on briefly so everyone gets their information in case anyone wants to, if anyone has any further questions. On behalf of all my colleagues at Hispanocare, Advocate Illinois Masonic Medical Center, Gottlieb Memorial Hospital, and Kathy O'Grady, Coordinator of Memory Loss Assessment with Advocate Healthcare, we want to thank you for allowing us to share this important information with you today. I would also like to thank Advocate Illinois Masonic Medical Center for continuing to support affordable, accessible, bilingual, and bicultural healthcare to Chicago's Latino community. My name is Daniel Maldonado, and I represent Hispanocare of Advocate Illinois Masonic Medical Center. I'd like to thank you for watching CanTV 21. Until next time, we invite you to tune in again in March when I will be your host on CanTV 21. Please stay tuned for more important information to follow in just a few minutes. Thank you for watching.